Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication that's actually a combination medication containing oxycodone and acetaminophen. Its brand name is Percocet. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So acetaminophen is an analgesic and antipyretic drug. It's a non-opiate and non-salicylate. Oxycodone is a semi-synthetic pure opioid agonist. It has multiple actions which are similar to those of morphine, and it acts predominantly in the central nervous system and on organs comprised of smooth muscle. In this combination product, its principal actions are that of an analgesic, and it also causes sedation. In terms of indications for use, Percocet is indicated to be used in the treatment of moderate to severe pain. Before somebody was to use Percocet, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have bronchial asthma unless they're in a supervised setting where the necessary resuscitative equipment is available. If a patient had a hypersensitivity to oxycodone or to acetaminophen or any other component of the product, they would not be able to use Percocet. It would be contraindicated in patients who have a known or suspected gastrointestinal obstruction. This would include paralytic ileus, and it would also be contraindicated in respiratory depression, again, if the patient was using the medication in an unmonitored setting without the necessary resuscitative equipment available. Now, in terms of precautions, patients should be made aware that this medication has a high potential for addiction, misuse, and abuse. There would be an increased risk of this in patients who have a family history or a personal history of drug abuse or mental illness. Life-threatening and sometimes fatal respiratory depression has occurred with this medication, even when the medication was taken at prescribed doses. There would be an increased risk during treatment initiation when high doses are given, in elderly patients, as well as in debilitated patients. Accidental ingestion of Percocet may lead to fatal overdose caused by respiratory depression, especially in children. If somebody was to use Percocet for a prolonged amount of time during pregnancy, there would be a chance of neonatal opioid withdrawal syndrome. Patients should be made aware that severe liver injury has been reported with the use of Percocet. This is more likely when patients are using more than 4,000 milligrams of acetaminophen daily. So this would sometimes happen if people forget that there's Tylenol or acetaminophen in Percocet and they use other acetaminophen-containing products with their Percocet. If a patient is using Percocet and they also use benzodiazepines, they would be putting themselves at an increased risk of experiencing respiratory depression. They would also be putting themselves at an increased risk of experiencing a coma. Clinical diagnosis of some abdominal conditions may be obscured with the treatment of Percocet. It should be noted that Percocet is on the Beers criteria, which is a list of medication that the elderly population should either avoid or try to use very cautiously. Due to the impaired psychomotor function that the elderly population may experience when using Percocet, they may put themselves at an increased risk of experiencing falls, which, in this population, can lead to fractures. The use of this medication may decrease respiratory drive in patients who have COPD, or chronic obstructive pulmonary disease. You would want to avoid the use of Percocet in patients who have circulatory shock. This is because the vasodilation that can happen with oxycodone could further reduce cardiac output. It's not recommended to use this medication within 14 days of using a monoamine oxidase inhibitor. It's a good idea to avoid this medication in patients who have liver or hepatic disease because there would be an increased risk of acute liver failure. This medication cannot be given to an individual who has impaired consciousness or is in a coma. Long-term use of opioids may result in a decrease in sex hormones. Symptoms may involve a reduced interest in sex, impotence, or infertility. Laboratory evaluation may be warranted if these symptoms are observed. Opioid intolerant patients who are given large doses of Percocet or oxycodone would be at an increased risk of experiencing respiratory depression. The use of Percocet may induce or aggravate seizure disorder. And lastly, for precautions, it should be noted that the medication should not be stopped abruptly if a patient was using it for a long amount of time. This is because severe withdrawal symptoms may occur. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Percocet, they can usually expect to take their dose in tablet form. Patients should always be prescribed the lowest possible dose and for the shortest duration of time that still allows them to realize good therapeutic benefit. If somebody was to use Percocet tablets to treat their mild to severe pain, They would want to use a dose of between 2.5 and 10 milligrams of oxycodone and 325 to 650 of acetaminophen every 6 hours. This would be the dosing for the immediate release version. The maximum dose of oxycodone would be 60 milligrams per day, and the maximum dose of acetaminophen would be 4,000 milligrams daily. If somebody is getting their first opioid analgesic, and it happens to be Percocet extended release formulation, they could take 15 milligrams of oxycodone and 650 milligrams of acetaminophen every 12 hours. If required for further pain relief, they can take their second dose 8 hours after the first tablet. Subsequent doses would be given every 12 hours, and it's important to keep in mind that the maximum daily dose of acetaminophen is 4,000 milligrams daily. When patients are stopping Percocet, it's a good idea to titrate the dose downwards by 25 to 50% every 2 to 4 days. And we would taper more slowly if patients begin to show signs of withdrawal symptoms. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Percocet. So I'll go over some of those here now. Constipation seems to happen in 4% of patients using the extended release formulation, and nausea seems to happen in about 31%. 9% may experience vomiting. Dizziness may happen in 13% of patients. 10% may experience a headache. And lightheadedness, sedation, and somnolence come in at about 4%. Some more serious side effects would be disorders of pulmonary circulation, Stevens-Johnson syndrome, toxic epidermal necrolysis, granulocytosis or neutropenia, hepatotoxicity or liver failure, anaphylaxis or hypersensitivity reactions, respiratory rest, and finally respiratory depression. That's all we're going to talk about today with this combination product of oxycodone and acetaminophen, also known as Percocet. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.